The brain, a complex mystery organ that influences everything a person does, thinks, or feels. Life after a brain injury can feel just as mysterious and complex, trying to navigate services, experiencing potential isolation, different functioning, and much more. The rehabilitation process can impact the person as well as their supporters. It's often filled with ups, downs, and everything in between, all while the brain is relearning and making new connections within. Join us as the Brain Injury Association of North Carolina sits down with brain injury advocates to discuss a variety of topics surrounding life after brain injury. The more we understand the different aspects of services and effects of brain injury, the better we can help make connections within our community for individuals living with a brain injury. This is Making Connections. Today, we're going to talk about mental health and brain injury.
Hello, thank you all for joining us today. I'm here with Travis Glass, who's going to talk to us a little bit more about what his experiences is with brain injury, how it relates to mental health, adjustment, kind of all the things related to brain injury and his vast experience with that. So Travis, why don't you introduce yourself and kind of tell us a little bit more about how you got into the field of brain injury?
Yes, my name again is Travis Glass, and I'm currently work with Crossroads Counseling Center in Hickory, North Carolina. I've been working here for a little over 10 years now. And in approximately 2013, I asked about starting a rehabilitation program here, or a counseling program here for individuals with brain injury. And that comes from a long history of interest in brain injury from when I was in UNC Chapel Hill in 2005 to 2007. So around 2013, I started developing that, and it's gradually grown since then. About 50% of the individuals I see are individuals with brain injury now. I also serve individuals with autism, and that's another higher percentage of individuals I see within there. I have experience before even going to UNC Chapel Hill also with serving individuals with brain injury and individuals with disabilities. And actually it all started back in June of 1999, where I experienced my own traumatic brain injury. I was in a car accident and got thrown from the car and fractured my left temporal part of my skull. It was a severe traumatic brain injury, but I feel very lucky to make it with the growth that I've made since my brain injury. And it also led me on a path. I was just finishing undergraduate school in 1999, and from that time I started working in mental health. My two degrees were actually business management and English education, but started working in mental health, and I've worked my way up, worked my way from the bottom up. I'm starting with in a day program for individuals with developmental disabilities, and then I stepped into there from case management, and then went from case management to supervising services, and that was early 2000s, and then decided I wanted to go back to graduate school. So I went to graduate school in 2005 to 2007. The year after that, I worked with workman's compensation, an office that did primary workman's compensation for individuals with brain injury, and so I worked within there. And so I've gradually progressed through time toward trying to manage a portion of this practice at Crossroads Counseling Center that's directly toward individuals with brain injury.
Yeah, it definitely sounds like you have a very wide range of experiences, and then, you know, even your own experience with brain injury has kind of set you on this path to help others that are impacted by brain injury. And since you've had these kind of really different areas of working with individuals. Have you seen anything particularly related to mental health that often triggers more negative mental health experiences or psychiatric symptoms that someone might experience after a brain injury?
Yeah, I think that's a complicated question, and I've actually read some research about this, but I will say there's no definitive precursors of mental health after brain injury. And why I say that is, first you have traumatic brain injury, then you have other types of brain injury like strokes or aneurysms, and then you have the severity of brain injury, from mild brain injury to moderate brain injury to severe brain injury. So to find a precursor for brain injury is difficult. However, there are some things, and then within research, within one research article, it talks about 38.5% of individuals with traumatic brain injury also have alcohol or substance abuse problems, and that's the most prominent. And is it that they're on alcohol at the time? Well, sometimes they are, but there's also individuals that have alcohol and substance abuse problems are a lot more risky, and therefore more likely to have risk behavior that may result in traumatic brain injury. And so some other things, they're more likely with mood disorder. The study said 23% of individuals with mood disorders may lead to psychological issues, psychiatric issues after the brain injury, and 21% of people with anxiety disorders before the brain injury may lead to psychiatric conditions after the brain injury. However, mood disorders and anxiety disorders are the most common before psychiatric conditions anyway. So again, it really depends upon the person. I do notice there's one thing with statistics, and I've noticed this since earlier on, that individuals with moderate to severe brain injuries often have a later onset of depression. And so the time frame of that could be 6 months to a year, or 6 months to a year and a half. Again, it varies for every individual with brain injury or traumatic brain injury, but it's usually later onset. Where individuals with mild brain injuries will have an earlier onset of anxiety and depression. I think the anxiety is a little more complicated if an individual is aware of it earlier on for it to be diagnosed. But depression is definitely more likely to be at a later time after the brain injury. So it's not necessarily a precursor, but it's an outcome, a mental health outcome after brain injury.
Yeah, I think that as people, we want to put a lot of like numbers and put people into categories like, check mark, you have this, you have that, you have the other, and then you have this. But when it comes to brain injury, it's just not that simple, with everyone having their own experiences, having like the area of the brain that's injured, their support system, the access to rehabilitation. It's just, it just doesn't have a clear box, I think. And I think a lot of people want that.
Yeah, I like that. I think along with that, and a lot of times we talk about brain injury and we put it into one term. A traumatic brain injury or acquired brain injury are different in itself, but we talk about brain injury. But we would not ask that question about physical injury. Is there a precursor for physical injury? We don't ask that because we'll say is there a precursor toward a broken leg or a cancer or a heart condition. But in reality, the brain itself is more complicated in my concept than the entire body itself, but we still label it as brain injury. I think that at some point in time, we'll move beyond that, especially in psychological and mental health. And instead of brain injury, and even with diagnosis of depression, anxiety, psychiatric issues, we'll focus on parts of the brain that are relative to those psychiatric issues. We may even replace some of these things, some of these terms we use, like schizophrenia, with portions of the brain rather than schizophrenia. And so the brain itself is so complex that it's difficult to define it, and especially difficult to define a person by the brain injury itself.
Absolutely. Yeah. And I think we see that when, as we see years go on and on, how even psychiatric terms change and what they're labeled as or what their causes are. You see that. It's like, what used to be shell shock syndrome or something, now is post-traumatic stress disorder, and then they look at the relationship with that and brain injury and how that combines, particularly in veteran and military populations. I mean, I think there's just so much that we still have yet to know. And, like you said, the brain is just so it's so expansive in terms of what it does. You know, when people say like, oh, it's matters of the heart, and I'm always like, no, that's your brain. Your heart's just kind of
Right.
pumping the, you know, blood and circulation, but like your brain is actually the thing that feels the emotions, that has the power to really control our lives in every way, shape, or form. Yeah. And so have you seen kind of, you know, talking about mental health, we've got brain injury, talked about substance misuse, and I know there are a lot of other kind of things and, you know, diagnoses as we put people into boxes that make up a person. Have you seen that have an impact on outcomes or, you know, present rehabilitation barriers? Like you mentioned, you know, having depression later in life, you know, do you see, you know, how does that impact a person?
Yeah, I definitely see that as far as treating individuals for certain symptoms, it becomes very complex because, as you mentioned earlier, the brain really does everything within our system. There may be some argument about spirituality in regards to that, but beyond that, the brain does everything. And even with spirituality, individuals that have severe brain injury may have different connections to spiritual forms than they did before the brain injury, and not all the time, but sometimes. In both ways, either being more spiritual or less spiritual in certain ways, like that. So the brain does everything within there. And so I like to show you a slide in regards to this. I talk about complexity of brain injury, and I want to show you two different slides or images that I use sometimes. And so just one second, I'll show you that. And there I have a slide there. It's about mental health and behavioral conditions. So we talk about complexity of brain injury itself. We start looking at mental health conditions. And so from there, anxiety, depression, anger and conduct disorders, obsessive compulsive tendencies, post-traumatic stress disorder, substance abuse, some sleep-wake disorders, psychiatric issues after brain injury. And so a variety of different mental health conditions that can exist and it can coexist. The most common that I treat and diagnosed with are generalized anxiety disorder and major depressive disorder. And they overlap and intertwine together. They're not necessarily separate. We like to use different terms, but they overlap like that. So if we just look at mental health conditions and different mental health conditions that can be there, that becomes very complex after brain injury. But then if I add this other slide here, is cognitive functioning, an overview of cognitive functioning after brain injury, or cognitive functioning in general, but when I use it, it's relative to brain injury. And then when we start looking at cognitive functioning, to me, cognitive functioning is just as complex, if not more complex, than mental health conditions are. And so from up top, we're thinking about sensory processing, and then we have attention, then we have memory, and then we have this term executive function. It really means so many different things within there. In fact, they all do. Memory is a complicated term also. So when we start to implement cognitive functioning in there, and how an individual with cognitive functioning, how it may interact with treatment, that's very complicated. And an example that would be, suppose I have someone with severe or significant memory challenges. Well, I'm going to need to treat them differently than I do an individual without memory challenges. And memory is the most common long-term cognitive functioning condition after moderate to severe traumatic brain injury. And so that's something I address quite often. And within that, it's reviewing the information with the individual again. It's giving them handouts to take home with them. And so it's a consistent process of reviewing things and making things sometimes more simple, which is really in counseling to make it's helpful to make things more simple anyway than complex. But it's taking in consideration both mental health and cognitive functioning. And so within there, I need to prioritize. I need to prioritize what works and what would not work, or what is most important and what is least important. And oftentimes, you know, I'll have multiple goals for an individual, but it starts off with one goal. And the most common goal I think that I start off with over and over again is stress management. It's not always the case, but stress management for an individual with severe brain injury, moderate severe brain injury, they go into the hospital system. They have sometimes long-term treatment in the hospital system. They may have physical injury also. They leave the hospital system, go to outpatient treatment. They come back home. And then when they're back home, things are not the same as they were before. And all of these are stressors in that individual's life. And that stress starts to build up day after day, week after week, and month after month, until it becomes chronic stress. And a lot of times that individual is not aware of that chronic stress. And so when we start to integrate in just stress response itself, mental health conditions, and cognitive functioning, it becomes very complex to integrate those in together to treat someone. And there's one other thing I'd like to add about this. When I was doing, and I didn't mention this earlier, but one other thing that I've been doing recently over the past in past year, from about September of 2019 till July of 2020, I've been helping disability rights in North Carolina with research about unmet needs in North Carolina. And my responsibility was to do interviews with individuals, with 10 individuals with brain injury and 5 professionals. And from that, when you think about serving individuals, there were individuals that talked about the service they received and what their service needs were. And I had one quote from an individual that I interviewed that I thought was, it's moving and interesting, and it helps people understand the complexity. And this person's name, his pseudonym is Elijah. He was 52 years old, and it was 8 years and 4 months after his traumatic brain injury. And when I interviewed him and his mom together. He lived on his own, but his mom still helped out with multiple things. But his mom actually went by his home every day. And so when I was talking to Elijah, he talked about different things, and I'll just read this part here. And it says, Elijah has significant challenges with both depression and anxiety. Elijah has on several occasions left an appliance turned on, such as a kitchen stove. When asked why panic attacks occur, he explained, it's like the burnt tea thing. Then they gave me a panic attack because I was scared that I could have burnt my house down. I could have burnt my dog. I could have burnt somebody. Or mama could have went in there and caught on fire. I've had a panic attack thinking about it because I will be sitting down in the kitchen. And I mean, I know I already made my tea and everything, but I still get on the living room, get up out of the living room. I mean, be in the living room. I'll go up out of the living room, go in the kitchen to make sure there's nothing sitting on the stove. But then I asked a follow-up question about depression. And he says, now I get depressed a lot too. I feel like me forgetting things, me wanting to do things, but I can't do things because I ain't got the way to do things. I sit there and I sit there. I think about it, and I start crying, tears running down my face because I can't do it on my own. I think Elijah is a good example of the complexity of the mental health and the cognitive functioning, how it interferes with the independent living, which also, with existential concepts, impacts mental health and sense of being. And then when I talk to individuals, I see that consistently, or with a lot of individuals at least, and also with the work I do with Hickory Branch Support Group, is that individuals just having a combination of things, not one thing, and a combination of mental health conditions. Like Elijah, I wasn't able to diagnose him, but like that depression, generalized anxiety disorder, and I've had panic attacks. And so those are complicated things to work with when considering together.
Yeah, absolutely. It definitely hit on, what you mentioned, kind of like the chronic stressors that individuals with brain injury often face. It's almost like because as soon as the injury happens, which is oftentimes, whether it's traumatic or non-traumatic, it's often an instant. And then you're in this constant stress state, whether it's you're in the hospital in the new environment, you don't know what's going on, maybe you're having memory challenges, which is confusing. And then, you're navigating this new world, without any particular roadmap, maybe without their proper help or anything like that. And so that stressor can build up and either lend itself to mental health challenges that really impact someone's daily living, or even physical health challenges too, as we know, with chronic stress having a significant impact on one's, heart and just bodily function, sleep, for example, which again has like a correlation with mental health as well. And you talked about the importance of, with these stressors, looking at kind of you mentioned there's might be like a spiritual component, and I know that there's a lot of like social components after a brain injury as well that really can act as very helpful in these stressors. What has been your experience, as you mentioned, as a support group leader, and just in your research, in anything, the importance of kind of socialization, particularly in this time of isolation almost that we are in right now?
Yeah, there's a study done by Harvard University. It's a famous study. I actually learned about it a couple of years ago when I was watching TED Talks, and I've read about it since. There's a study done with Harvard University that's been going on since 1938, and then so it's a longitudinal study. It started out with a group of people, like 20 or 40, but it gradually added more people over time. Originally, the individuals were from Harvard, and then they added on individuals from, I think, Pittsburgh and Philadelphia too, that were lower income individuals and like that. So it's gradually expanded over time. And there's one important thing that this study shows as it expands over time, that positive relationships is the biggest connector to well-being in existence. And they did this study in a quantitative and qualitative way. They've done research within scans of the brain, scans of the heart, and other components within this research. But when they show that positive relationships has more impact than money, more impact than fame, more impact than IQ, and actually has more impact than a person's genetic sequence, than general well-being for the whole population. And so when we think about positive relationships and connection, it's definitely a need for individuals. And sometimes for like with Hickory Brain Support Group, individuals, some individuals, not all individuals, everyone's different, but some individuals, especially individuals that have a brain injury at a certain time in their life, like at a young age, the transition either from high school to college, they may not have any friendship connections before joining the support group. And so without friendships there, that's a big lack of support and connection. They may have family there, but family is only one part of connecting with others. And so developing those positive relationships are important. That's what we try to do with Hickory Branch Support Group. I think also the support group does another thing that's very helpful, is that even if we have connections with people, we may not be like the individual. And so having commonalities with the individual is important. And a lot of individuals with brain injury, especially in more suburban areas, they don't know another individual with severe brain injury. And so they don't have a connection right there. And the brain injury allows a connection. It allows a person to not feel like an outcast, that they're the only person that is this way. And they get to see other individuals that are different, but there are some similarities within there. And so I think the support group also adds another component there, that we have some individuals in the support group that are just joining, and some individuals with the support group that have been there for a significant amount of time. And so sometimes the individuals that have been there are significant, but they've learned things. They've learned things to help themselves. And then when we talk in the support group, it can give input to the other individual, and they can learn from it. And so all of those are positive things about the support group, and making connections and learning from other individuals. However, there's a significant challenge with the support group, is that we only meet once a month. And it's something that I lead and I volunteer for it. Several other members of the support group volunteer also to do parts of it. But it's really quite a bit of work to do the support group and get things organized and ready. And it's only once a month. It'd be a lot more helpful if it were once a week, or some other pattern like that. I know that Asheville does it, I think, once every other week. But I think they have professionals get paid to do that, and we're a volunteer support group. So, but still, it's helpful. It's better to have one here. I'm glad to support it. I was actually in a support group back in 2002 also, and so it's better to have one and be able to be connected than not.
Yeah, absolutely. And I know that peer support component can sometimes be 10 times more helpful than someone that maybe has no experience with brain injury, or, having someone that's been through it versus a professional, as much as they can help. There's just a different bond between individuals with lived experience.
One other component of that is that with our support group, we do planned it this way since the beginning. It seems to work fairly well. We have one support group meeting that we have a speaker or a topic to talk about, and the best speakers are individuals with brain injury talking about their experience, or a caregiver coming in and talk about their experience, or a family member talking their experience. Those are the best speakers that we have. But also every other month we have some type of social event, or at least we did before COVID-19. To have a social event where we're doing something in the community or doing something together like game night. And so that intertwines two parts there. One is informational, and the other is just connection and having social action. We also do one event yearly where we go out in the community and do something. Like we went to the National Whitewater Center one year. We've been to Science Center one year. And so we went to actually the year before last, we went to the indoor skydiving. That was really exciting. And so getting individuals to go out and do things is also something that they feel, we all feel, I feel it too. We feel connected and enjoyment from.
We'll be right back.
I was 15 when I was in an accident.
I fell at work. I was a victim of abuse.
Over 200,000 North Carolinians are living with a brain injury. For those living with a brain injury or caring for those who do, the Brain Injury Association of North Carolina is here to offer help, hope, and a voice. We connect you with available providers, support groups, and get the answers you need on your journey after a brain injury. Visit BIANC.net now for more information on our education, support, prevention, and advocacy programs.
Absolutely. And sometimes, getting someone out of their comfort zone or something that they maybe wouldn't do by themselves, but then, doing it with a group, it's so powerful. And particularly for individuals with low motivation or, particularly depression or anxiety, like all of those, that can feel overwhelming. But when you have your group together, it's like you're all accomplishing, one task together. That's really fun.
Yeah, the interesting thing about the indoor skydiving was I was making sure that we went to the Whitewater Center one time, and some individuals had physical disabilities. So I really wanted to make sure it's okay for some individuals with physical disabilities and what they thought about the indoor skydiving. And they were in for it, and they actually did it. They got out there and floated in the air like that, and that was amazing. To see them have the courage to do it, and also the excitatory joy that they had that went along with it. So.
Absolutely. Yeah. One thing I've been in the brain injury space for a while now. And one thing you do, don't ever count someone out because they have a physical disability or challenge. Like, they want to do it. If you figure out a way to do it, they're going to have a great time. They're going to prove you wrong at any point because, they're some of the strongest people. All individuals with brain injury have been through situations that, individuals without have never experienced and, come back stronger. So I could definitely see that. And speaking of kind of coming back stronger or, building up strength almost after a brain injury, you build up strength physically in rehabilitation. But, there's a term called psychological resilience or how can someone, what is that term to you, or and how can someone kind of strengthen their mental health to kind of protect against any, mental health challenges that might develop in the future?
Yeah, I looked up the term psychological resilience last night, and the first definition I came on Google, I searched it and I came up, and this is the definition that came up, and it says psychological resilience, and this comes from Wikipedia. It says psychological resilience is the ability to mentally and emotionally cope with a crisis or to return to the pre-crisis status quickly. And when I see that definition, that doesn't fit individuals with brain injury. And I think that sometimes when we think of resilience, it's fighting back, and it's getting there quickly, or snapping back is another term that's used within resilience sometimes. That's not always used, but sometimes it is. And I think that's a misconception for individuals with brain injury, because especially moderate to severe brain injury, and even concussions, weeks of times to months of times with post-concussion, syndrome, it's a long road. I mean, it's not a short road. And I think that sometimes individuals, as they go through acute care to post-acute care, that's the thought in their mind. The thought in their mind is recovery because it's used over and over again. I prefer to use a different word of growth, and there's growth at the brain, there's growth day by day. But the concept of recovery and the concept of recovery and resilience can sometimes conflict with each other. Because a lot of individuals with moderate severe brain injury, they don't go back to the same status that they were before. And then with that expectation of going back to the same status, that sometimes can lead to depression. So when I think about resilience, it's a long road. Oftentimes I use the analogy of like walking up a mountain, and there's steps up the mountain to get to the top or get plateau. But when you're walking up the mountain, there may be a step back or two and then a step forward. And so it's just not steps straight up the mountain. There's steps forward, steps back. You may not even reach to the same point where you were before. There's also 3 A's I use a lot of times. I use A's, I developed these over time, and I just use them consistently now. And the 3 A's are awareness, acceptance, and adjustment. And I think all 3 of those terms sort of come in progression. However, sometimes they lap back and forth. And that psychological awareness and awareness of the individual is a very important part of resilience, because how can we overcome something if we don't understand and are not aware of that thing that we're trying to overcome? Along with that awareness then comes acceptance, and the acceptance is also a long-term process, and it's not an immediate thing. An individual with severe brain injury don't automatically say, I accept this, and it's over. At times after long-term brain injury, there's acceptance and then non-acceptance. Along with that acceptance comes grief. And that's where grief is different than sometimes grief of a person with death. The grief, someone who dies in your family, the grief immediately comes. It still may last long-term, and the grief may never go away. But sometimes the grief for an individual brain injury can occur 6 months after the brain injury. And that's when an individual starts to grieve. And it may last for a year and a half, 2 years. For some individuals, they grieve for the rest of their life because they don't have support or mental health support to help them. They don't know how to come to acceptance. And that last part is adjustment. Once we have acceptance, then we can adjust or grow is another way to think of that. But until we have that acceptance, that awareness and acceptance becomes really hard to grow. And I'll give you an example for that. Suppose an individual has memory challenges. Suppose they have episodic memory challenges. So autobiographical things in their life that were there the day before or the week before or 2 weeks before, they have a really hard time remembering those things. And so they become aware of that over time. They're usually not aware of that right when they get out of the hospital or when out of outpatient therapy. It comes sometime where they become aware of it. And then when they become aware of it, they start to grieve. Now that acceptance of it is important, that they have this problem. They don't mean that problem's necessarily going to be there forever. It's not going to be the same way. They can learn strategies to help themselves. They can work the brain, and the brain can get better. It may not get back to the same way it was before, but it can get better. Sometimes they can use strategies that may help them in certain ways they never used these strategies before. So that awareness and acceptance and adjustment are all 3 components of resilience. And again, resilience is not an immediate thing, but a long-term thing.
Definitely. I really like the 3 A's that you mentioned and how it is a long journey. It's a rehabilitative journey. It's a lot of stress, a lot of work with a lot of goals and a lot of growth, though. I know I've seen a lot of people that, research would say, 2 years is the most amount of growth that a person can have after a brain injury. And I'm like, I've seen people continuing to grow, for the rest of their lives, as long as they're working for it and they want it and, they have the support to do so. And so I always, the growth is a lifelong process, which is tough.
I'd like to mention one thing about that growth when you talk about the 2-year time frame. I think it used to be 1-year time frame, now it's 2-year time frame. And then I had someone I interviewed who I think she says that there's neurological growth in a 2-year time frame. And so maybe there's growth beyond that, but I think that it's really hard to know. I think a lot of individuals that lack long-term growth, they become stagnant. So they come back home, they have severe disability, they don't get a chance to go back to work. If they do get a chance to go to work, they don't follow the path, or they're unsuccessful to begin with. And so they're not working. They don't have very many social opportunities outside of that. And so they may have certain hobbies, but they may not really expand the hobby and work on it and come in depth with that hobby. And so they sometimes become stagnant and sitting there at home. And the brain has a lot less likelihood to grow and continue growth when you're sitting there at home. And so the brain growth comes similar to a growth of a muscle injury. It comes with consistency. It comes with working that brain consistently over and over again. You don't want to come fatigue and overwork the brain, but you do want to work the brain. And individuals that lack that are there at home, they don't have opportunities to get out of the home. There's not a day program that exists within their community, or a job that exists they found, or volunteer work they found. That can be very difficult for that continued growth beyond a year to 2 years.
So true. Yeah, that's a really good point to make. And I think, again, also about, the impact and the role of family members, caregivers, any supporters that a person might have. What have you seen, how have you seen them play into kind of mental health, growth, and empowerment in your experience with brain injury?
Yeah, I did a presentation about this. One of the first presentations I did probably 7, 8 years ago with Partners Behavioral Healthcare, maybe 6 years ago, Partners Behavioral Healthcare, and it was about reaching your full potential after brain injury. And I came up with 5 concepts of reaching full potential. One is support. And so one of the key components of that is family support. And so having that support there, it's important in so many different ways. One is having someone to talk to and to grieve with, and to be there with, that will listen to you when you're having these challenges. For the person who does not have that support, and family support is the most common support for that family, or husband, wife, or like that, or a partner. Without that support, the person remains there with those thoughts inside their mind and not able to express them. And so the support's there for family support is very important from the whole process, from acute to post-acute and beyond, because individuals with severe to moderate brain injury may not be able to manage their services and know what services are out there and make decisions about those services. So the family comes in as support there to help them make those services, especially in those early stages of rehabilitation. And so I just think having that support is extremely important. I do also notice when I did the interviews for individuals with traumatic brain injury, family members were there often, probably about half the time for individuals that interviews. And the family members often have a burden with all the work that it places upon them. There's not sufficient case management to help these family members, especially if they lead the acute and post-acute setting. And so it's a really burden on them sometimes. They have benefit of giving to their family and giving to the person with brain injury, but it can be a burden also just for all the work that it is that they take on, especially if that person is severely disabled and lives inside the home and may live with the home throughout their entire rest of their life. And there's not sufficient day treatment, case management, and residential programs in North Carolina to meet the big need out there for those individuals.
Yeah, I was going to ask about kind of if you've seen an impact on caregiver and family support mental health, and it sounds like that's kind of what you've seen is there's a lot of those greater needs out there, particularly in North Carolina in our space, for both the individual and family members. Just more services are needed.
Yeah, when I speak to family members, I do service too. Sometimes it's with the individual, sometimes it's with the individuals. When I do counseling, sometimes with the individual and a family member. A lot depends upon the level of disability. A lot depends upon the length of time since the brain injury. I do like to sometimes touch in people with severe brain injury with the family member to begin with to understand. But when I talk to family members, I often tell them, especially some family members, they work so hard for the individual with brain injury. They do everything they can, but they also become exhausted. And so the family member needs to learn to give to themselves, to take the breaks that they need. And it helps to have someone tell them it's okay to take a break, to give them themselves. If we don't give to ourselves, the family members not give to themselves, oftentimes they run out of energy and don't have as much to give to the individual with survivor of brain injury.
And I think that that's where a lot, like counseling and mental health services, are so important for a lot of people. How have you found, is it, you mentioned some memory strategies, helping individuals with brain injury. Is there other types of things that you do differently when you're working with individuals with brain injury, particularly related to counseling?
Yeah, there's several things. I'm going through these different things in my mind within there. I'll mention just one concept relative to mental health, and it's a concept, it's not an action, and that's mindfulness. And the concept of mindfulness is so important for individuals in general, but it's very important for individuals with moderate severe brain injury and even individuals with mild brain injury that have post-concussion syndrome. And the concept of mindfulness is being in the present moment non-judgmentally. And it's a concept. It's being in the present moment non-judgmentally. It's not necessarily doing something like mindful meditation or yoga practice, but it is being in the present moment non-judgmentally. And oftentimes that's difficult for a person to do. It would seem like that it's easy to be in the present moment, but in our society, that's not how the majority of our society works. We're a constant thinking society. We're thinking about the future. We're thinking about the past. And so how things will be or how things were, and that how things were is so important for individuals with brain injury. That concept comes up. Individuals with moderate severe brain injury with long-term disability, how it was before. It's a consistent thing that's there for a lot of individuals that I work with. And mindfulness helps us step out of that. If we can be mindful and be in the present moment and just be there with ourselves, we can move on. We can think afterwards. And sometimes we're with our thought in the present moment. But it's not necessarily about the past or the future. It's just being in the present moment. And I think that's one thing that I learned. I actually learned at Chapel Hill. I had 2 classes there when I was there in 2005 and 2006. But then use it consistently myself. And I help implement it inside practice. And so, for instance, seeing an individual, we may start off with mindful practice at the beginning of a session, which may be a meditation practice, a 5-minute meditation, or a 3-minute body scan at the beginning of practice. And as we practice it inside the session, and they take it home outside the session, then they can learn to be in the present moment and not linger so much into the past or the dread of the future and what's going to be in their future, but learn to be in the present moment. And I think that's one technique that I use more consistently with almost every person with brain injury.
Yeah, that's definitely that. It's a skill to be able to be mindful and meditate. And I know it's something that I've tried multiple times in my life, some with great success, some with not, just because, like you said, just sort of our society, we're constantly stimulated. We have our phones, right nearby, our computers, our TVs. And, I think another way for that kind of mindfulness to be really helpful for individuals with brain injury is to prevent some of that stimulation fatigue that can happen a lot, like cognitive fatigue, when it comes to just daily life when we're bombarded with all this, information that our brain has to process.
Yeah, the cognitive fatigue there. The cognitive fatigue is another thing that I can just work on. I'll talk about anxiety, depression, but cognitive fatigue, and not only cognitive fatigue, but just the stress fatigue. So fatigue can come with cognitive, physical, or emotional fatigue, and they all intertwine together. And so an individual being able to take a break from that and take a breath for themselves and breathe out and be aware of where they're at. I also give a scale, and I got this scale from a speech therapist at I don't remember her name, when she was at a conference a few years back, but the scale has fresh as a daisy, and at the end it's hitting the wall. And then what an individual with brain injury does not want to do, they don't want to hit the wall. And because when you hit the wall, and this would be in life in general, but individuals with brain injury is different. When they hit the wall, they become extremely fatigued. And sometimes that can be for an hour, sometimes it can be for a day, sometimes it can be for multiple days. And so by being aware of oneself, by being mindful of oneself, they know where they're at on that scale. They can say, I'm at a 3 right now, or I'm at a 4, I need to take a break. And so I'm at a 5. I must take a break now. I've already got there. And so to see oneself and the stress response one has, the fatigue one has, I think is very important.
Absolutely. Well, I think that's really all the main questions that I had today. Thank you so much. Is there anything that you kind of want to leave the viewers with, just related to brain injury, mental health, and what they can take away from your experience?
Now, there's just one more thing I'd like to add. It's one topic I wanted to mention within there, and it's relative to systems of care. And I've known this system of care. I studied system of care when you see Chapel Hill and how it worked and the challenge system of care. And that's also what I help disability rights with. I like to show an image of system of care and show there's one significant challenge within the system of care, and then maybe finish on a positive note. I like to add this. I like to share my screen and within system of care, if you look at this image in the system of care, and it's a complicated image, so I'll just briefly go through it. You have acute care, and acute care is medical surgical. You have acute rehabilitation, and acute rehabilitation is acute inpatient rehabilitation, subacute care. Then you have this post-acute care, which can be outpatient therapy they receive. Sometimes you have outpatient day hospital, like comp rehab at Baptist Hospital, where individual will go there throughout the day, or the stick center at Baptist Hospital, where the individual will stay overnight there. And so you have these different types of post-acute care. And it seems like this care is very effective for individuals with brain injury. And as long as their insurance will cover long enough, these are very effective treatments. The problem is individuals leave this system and then they come to this community-based rehabilitation and support care. And there's a disconnect between those two. You have the hospital system and the community system, or the medical system and the community system, and there's a big differentiation within there. And a lot of individuals become lost within that separation. They leave one and go to another. Now I'm sure that's part of the role of the Brain Injury Association in North Carolina, is to help individuals with that transition. But a lot of people don't know about the Brain Injury Association in North Carolina. They may have been told, but they've probably forgotten since they left the outpatient there. Some individuals go to outpatient and go immediately home, or go to acute and they go immediately home. And so people with mild to moderate post-concussive syndrome may not have any of these services. And so there's that transition that occurs over time, and there's a lapse between that community-based services. And so when I think about one need there that's more than any other need, it would be more case management and care coordination. And so individuals don't know about these things. Professionals in the acute system often don't know about things. They don't know about MHD, DSES, and all the different services available underneath that. And so if they don't know about it, how are they supposed to seek it? And so having TBI case management professionals that are funded, I guess would be funded through the state, that help over time would be an extreme benefit. And I think a lot of people become lost in there. And that's also all 10 individuals I interviewed with brain injury both talked about the lack of case management and service coordination. They leave the hospital system and then they're on their own. And that's not always the case, but it's the case most of the time.
Yeah, that's definitely something that we've seen, and as the Brain Injury Association of North Carolina, I can say that it's definitely the awareness piece of that we're here is definitely a struggle, and I hope that something with more accessible case management to individuals, because there are services that do private case management, but then some people are not able to afford such services or don't have access to those services. So
workman's comp helps out a whole lot with that. If you have workman's comp, but there's very few that have that.
Exactly. So the accessibility component of case management is so key, and I definitely hope to see that in our future in North Carolina.
I'm sorry, I don't want to end on that grim part. There's still a lot of positive things with brain injury recovery and growth after brain injury. And you mentioned something about resilience earlier too. And individuals with brain injury, that's not the end of their life. Their life continues to exist, and we learn through suffering. And so Viktor Frankl expresses that over again. We learn through suffering, and we can learn through suffering. It's not an easy road, but maybe it's not made to be easy. And that's what suffering is. And so a lot of individuals with brain injury know things a different way than they've known before. they see things a different way than they did before. And so they may be more mindful of existence than they were before. And where before they may have more binocular vision, not seeing the whole. And so brain injury is definitely a challenge, just as other injuries are. But sometimes we can take steps forward like that and make progress. So.
Absolutely, yeah. Looking at, I think it all comes with seeing where there are greater needs, and then seeing where there are definitely, you know, there are positive steps that we can all take towards more positive well-being, more positive mental health. And I think that, you know, COVID-19 pandemic, et cetera, kind of gave a look at what it's like when you're not able to do things that you once were able to do, not being able to connect with people. And I think that's what a lot of individuals with brain injury face, you know, after their injury. And now just everyone else is kind of being able to experience even just a small glimpse of that experience. And it'll be interesting to see how services are able to change now. I know, you know, a lot of people are doing more telehealth options, more video calls. Individuals with brain injury are kind of being more used to being on the computer to be able to connect with different people. And I hope that that translates, you know, when we hopefully go back all in person and whatnot, because I think that access and transportation and those type of challenges were creating a lot of barriers for individuals to be able to connect with either services or people. And, you know, hopefully we see that as kind of translated, you know, from all this, that individuals are able to connect more and have more access to services, and that gaps would be filled. Excellent. Well, thank you so much. I really appreciate it. How can people get in contact with you, or if they have any questions, learn more information?
You could look at online. You can look at Crossroads Counseling Center and look on there. Within Crossroads Counseling Center, I think it's Crossroads Counseling Center Brain Injury. You can probably Google search that. You also, the individuals that are interested in the support group are welcome to give me a call. My number is 828-327-6633. Or individuals interested in the services too. Actually, I talk to anyone relative to brain injury, and so they're just welcome to call me. And so either about services or the support group, or wanting to know about what services are around that might meet their needs. And then the other thing for the Hickory Brain Injury Support Group is we have a Facebook page. It's Hickory. It's Facebook/Hickory BISG, and that BISG stands for Brain Injury Support Group. You can also just Google search or Facebook search Hickory Brain Injury Support Group. So.
Wonderful. Thank you so much. And I hope everyone out there has a wonderful day.
Well, thank you.